Hello friends, good afternoon. Welcome back to yet another interesting educational session of Manju's testimony. Today I'm going to talk about OET speaking. I will tell you a few important things that you can keep in your mind while you are practicing your OET speaking. So let's start the video. First of all, you have to understand that OET speaking is not going to test your medical knowledge. It is all about your language understanding and how effectively you can speak without losing your coherence and fluency. So this is what about OET speaking. So you don't have to worry about your medical knowledge or any of the conditions that you are not aware of. It's okay, it's completely fine. You have already a cue card on your hands. You have all the information there. You just have to look through the information and collect or formulate it in an effective way to conversate to the examiner or the patient in front of you. Okay, so you don't have to worry about your medical knowledge. This is the first and foremost important thing. The next thing is 3 minutes preparation time. As we all know, we will get 3 minutes preparation time before the speaking. So how effectively we can use this 3 minutes preparation time? This is very important because your speaking in the next 5 minutes is truly based on this preparation. How effectively you can prepare this 3 minutes? I'm going to tell you a method that you can follow to formulate your information. Let me explain you in brief about a method that you can use in the 3 minutes preparation time. First of all, we can divide our speaking into two parts. The first part is collecting the information from the patient, and the second part is giving the information from our side to the patient. So in most of the cases, the first few tasks of the cue card is to get to know the patient or history, ask the patient dietary habits, ask the patient's exercise regime. So the first few tasks is all about collecting information from the patient, whatever it is. The aim is like that, and the second part is giving the information from our side. So if you look the cue cards, most of the cue cards is in the same format. So we can divide, as I told you, it into two parts. So when you get your cue card, just divide the tasks into two categories and write on your paper about the first category. Ask. You don't have to write all these sentences because we have limited 3 minutes time, right? So just write ask diet. Then next point, put the next arrow, ask medication. The next arrow, ask exercise regime. So just formulate all these three tasks into these small points on your paper. So when we start speaking, just look at this paper and understand that the first task that you have to complete is ask the patient dietary habits. So we can start the conversation. For example, you can ask the patient name and introduce yourself. After that, I'm just talking about the main points. Okay, introduction is already there, and you just have to learn how to introduce yourself and how to get know about patients. Okay, so after that, when it comes to the main point, you can start like, okay, Mr. Tom, I understand your concern. We will talk about the weight loss regime. I can provide you with all the information that you need to follow to reduce your weight. But before that, may I ask you a few questions about your dietary habits? Is that okay? So just start the conversation like collecting information. So we wrote like ask about patient diet. So we start the conversation based on that key point. Okay, so we ask the patient permission before starting the conversation, whether he is okay to communicate those things to us. So this is very important. We all the time we have to ask about the patient convenience before collecting any information from the patient side. Okay, so it will give you a formal structure for your conversation. You can start your conversation and go through the conversation in any of the way that you feel good, but if you follow these steps or if you follow like this, it will give a formal structure to your speaking. So I'm recommending you to follow this structure so that you can effectively communicate and impress your examiner and the audio tracker who are sitting there in the Australia to evaluate your speaking. So we completed the first tag, then come to the next point. So the patient give you all the information about the dietary habits, but still we need to get some more information from the patient without boring the patient, right? So we can tell, so the patient already gave us the information about his dietary habits, so we need to thank him. So just tell him, so thank you so much, Mr. Tom, to give me the information about your dietary habits. Secondly, would you mind telling me about a few information about your job? So in this way, you can maintain the flow of your conversation. So first, we categorize the task into two parts. The first category, we have to go in this way. Okay. Then After that, when we complete all the information gathering, we have to recapitalize the things to the patient again. So after collecting all the information, after you finish all your information collection, you can recapitalize the information to the patient again. For example, you can tell to the patient like, so Tom, thank you so much for your cooperation. So from this conversation, I could understand that you are following a sedentary lifestyle and you don't have that much regular exercise in your routine, and your diet is almost fast food and junk food, and you are working as a computer operator and you don't have any active physical work in your day-to-day life. Am I right, Mr. Tom? Then the patient will reply, yes, you are right. Then you can start your next part of the conversation is giving the information. So before starting the conversation also, you have to introduce what you are going to tell in the next portion of the conversation. So before giving the information also, you have to tell the patient exactly what all things you are going to tell to the patient. You can tell to the patient like this. So Tom, thank you so much for your information. Now I'm gonna tell you how you can effectively lose your weight. Firstly, I will give you a few exercise regime that you can incorporate in your day-to-day life. After that, I will tell you a list of foods that you can follow on a daily basis to improve your dietary regime. And finally, I will give you information about weight loss programs that we are conducting in the hospital for you to attend on a monthly basis. So you can maintain the flow of your conversation like this way. So the point what I meant from all this information is that you have to structure your conversation in the 3 minutes preparation time. I will do a separate video for the 3 minutes preparation time, how effectively you can use this 3 minutes preparation, how can you derive the relevant information from the cue card, how can you write the relevant information on a paper as a small sentence without losing your time, and how to effectively structure a conversation. All these things I will include in the next video. So that is about 3 minutes preparation. So as I told you, don't forget to ask about the patient convenience for giving the information or listening your suggestion. So you can ask in between, are you okay? Is that okay? Are you willing to share this information? Am I right? Would that be okay? Try to collect a few sentences like this and try to incorporate these sentences in your next speaking practice and make it as a habit of your speaking. Then you can make your conversation in a formal, structured way. Okay. One more thing, for giving the structure to your conversation, you can use some words like firstly, followed by, following, secondly, all about, after all, then. Such type of connective words will help you to maintain the coherence of your conversation, coherence of your speaking. So try to catch some words like this and include in your conversation to maintain the structure. Okay, so we talk about the preparation time. The third important point is during the conversation. What all things we have to take care during the conversation. So let's see what all things that you can take care while you talk to the patient to maintain an effective conversation. First of all, the most important thing is to understand that the person sitting in front of you is a patient. It is not an examiner or it is not a speaking partner. Please assume that it is a real patient. Okay, so how we gonna talk to a real patient? The patient is a person with a problem, right? So a person with a problem is definitely not happy. They are already worried, disappointed, and they have so many worries in their mind. So we cannot tell anybody who are worried already that please don't worry. So if you are using this word, please don't worry, we are here to help you, please stop it right now. We cannot tell to any patient not to get worried because it is their stage. They are already worried. We cannot deny the fact that the patient is worried. Instead of saying don't worry, you can use a conversation like this. I understand your feelings. I knew that you are so worried and you have a lot of doubts about your condition. We have a good panel of doctors and nurses here, and our hospital is well equipped with all the state-of-the-art facilities. So patient care is our utmost priority. We are here to help you to get out from your condition. So in conclusion, I would say you have to empathize your conversation rather than sympathizing. Sympathy is not accepted in a healthcare settings. We have to empathize with the patient. So try to catch some sentences that will help you to showcase your empathy. For example, I understand your concerns. I have seen a lot of patients with your same condition. If I were you, I would have felt the same. So try to empathize with the patient rather than sympathizing. We cannot deny the fact that the patient is worried. Okay, so please showcase your empathy at its maximum level. Okay, it matters. Whatever the conversation you are following, try to put some empathetic words and sentences in your conversation to make the patient comfortable and to make your conversation like a real life situation. Okay, the next point is voice modulation. You have to clearly maintain the tone of your voice. It should be up and down when you deal specific situations. For example, when you are giving a strong recommendations, try to stress your point. For example, I'm strongly recommend you to reduce your alcohol intake. So you have to stress the point that I'm strongly recommend you. But if you are giving a reassurance to the patient, your voice modulation should be reduced. It should be less. For example, I understand that you are worried. We cannot say that I understand you are worried. No, it is not like that. I understand that you are worried. We are here to help you. Okay, why I'm stressing you to improve your empathy and get rid of your sympathy? Let me explain you with an example. This is a real life situation actually happened in my own life. In my real OET exam, I was given with a cue card where the patient was admitted with a snake bite, and I am the nurse attending. I have to start the conversation with this patient. So I told the patient, please don't worry, we are here to help you. We have a good panel of doctors to help you, and we have all the medications available here to treat people with the snake bite. We have all the antivenoms available here. So you don't have to worry about anything. So I started my conversation like this, and I structure my conversation effectively. Everything I have done, as I'm telling you, I have done everything. But after that, when I stopped my 2 cue cards, my invigilator told me, actually he was a very good person. I will tell you about him in this video later. After completing the 2 speaking tasks, actually he talked to me. It's like a simple informal conversation. In that he asked me one point. Sister, actually you are a nurse, right? Are you really like this in the real situation? Suppose you get a patient with real snake bite. How can you tell you that patient not to get worried? The patient is already got snake bite and he is so afraid about his life. He may be thinking about his death even. So how can you tell a patient who is thinking about death to don't get worried? So please be a little bit empathic in your conversation. He advised me like this. Actually, I was so poor in empathizing with the patient. Actually, it is not because of that I don't have empathy. I did not give that much importance to showcase the empathy. I focused too much on my coherence, fluency, and completing the task. I did not focus that much on empathy and incorporating too much empathetic words into my speaking. Anyway, I passed in my speaking exam, but I understood one point, that it is very important to showcase your empathy in your conversation. Whatever conversation you have, whatever patient you get, your voice is being recorded and they can simply catch your feelings and emotion from your voice tone. So that's why I told you to maintain and balance the tone of your voice while you are giving specific information. So they are not catching our gestures and they are not catching our eye contact. It is not being recorded. Our physical presence is not being recorded. Only our audio is recorded. So the voice modulation and how much loud you can speak is also matters. So try to incorporate maximum empathetic words while you are speaking to a patient and say loudly as possible as you can. Okay. The next point is over usage of you. Instead of using you always, it's advisable to use the patient name rather than saying you again and again. Okay. So please try to use the patient name as needed in the conversation instead of using you. Okay. and you have to avoid repeating words and sentences in your conversation. It is applicable in both OET speaking and writing. Try to avoid the same type of sentences and vocabs in the conversation. Okay, so please collect some topic related vocabularies. Don't ever try to collect a lot of vocabularies from outside. If you're gonna collect vocabs for English language, it never ends. So for OET examination, you just have to collect topic related vocabs. Okay, for example, suppose a topic of colostomy, so you have to get some vocabs that is related to colostomy. Okay, and migraine, please collect some vocabs related to migraine. So if you have a bunch of topic related vocabs, you can use that in your conversation. When you collect these vocabs, try to use these new words in your conversation. Okay, no use if you just collect and keep it in your book. Try to use it in your conversation. So in my next video, I will give you some topic related vocabularies that you can write down and use in your later speaking practices. Okay, the next is the use of medical jargons. We are nurses and healthcare professionals, so we have a tendency to use medical terminologies while speaking with the patient. So in this case, please understand that the patient who is sitting in front of us is a normal person without any medical knowledge. So please try to avoid the medical jargons as possible as you can. But in some situations, we have to use medical terminologies. For example, see, if you are going to give a health education about colostomy, sometimes in our conversation we have to use the word stoma, right? So in this case it's okay, but don't forget to explain what is a stoma. You can say you have to take care of your stoma very clearly. A stoma means a bag that is attached to your abdomen. So please explain whatever terminologies you are using. Please reduce it to maximum, and if you are in need to use, just try to explain it to the patient. Okay, that's it. The next point is something that you can learn and use in all your speaking tasks. For example, a speaking task which includes something that how to talk about pain. If your task includes pain, you can use this sentence. Okay, I understand that you are in a lot of pain. Would you please rate your pain on a pain scale where 0 stands for less pain and 10 stands for the worst pain? So this point you can include in all your conversation where pain comes as a complaint. If your task includes pain, please learn it by heart. It's okay. It's very easy to learn, right? And please don't forget to include the sentence in the conversation where you got a pain assessment or pain task. Okay, the sentence is like this: I understand that you are in a lot of pain. Could you please rate your pain on a pain scale where 0 stands for less pain and 10 stands for the worst pain? Okay, I have one more point like the same. Suppose the patient started the pain at home and he came to the hospital after that. So in this case, you can ask, have you had any medication at home? Did you take any medication at home? So you can use the sentence in all scenario where the patient comes from home. So such type of words will definitely help you to bridge your conversation. So please learn some type of sentences like this and try to use these sentences in your conversation. Please remember these sentences and use in your conversation. You can use these sentences in all the conversation where the patient has the same scenario. Okay. The next point is about the order of the cue card. The cue card is in a specific order, right? But in our conversation, it is not necessary to follow the order as it is. If it change in between, it's okay, fine. We have to maintain the conversation clearly with the complete fluency and coherence. That only matters. It's okay. But try to complete all the tasks as possible as you can, because it will be evaluated whether you completed all the tasks which are given in the cue cards. Okay. So please focus on your coherency and fluency rather than completing the task in the order. The last point is end of your conversation. So if you are done with all your tasks and if you have finished the conversation, you finish everything before the time, please don't stop your conversation until the examiner tell you to stop. Okay, we have to maintain the conversation for 5 minutes. The examiner will tell you to stop. That time you can stop. Otherwise, if you finish all the tasks and you don't have anything to speak, just give some added information. For example, you can say we have a leaflet which includes all the information which I have talked to you today. So please keep it with you, and if you have any problems in future, please let us know. And in case of emergency, you can contact us on our hospital number, and we are here to help you. And please don't hesitate to come again if you have any problem. So in this way, you can give some added information to maintain your conversation until the examiner stop you. So hope that I have done with all my points. I expect you to follow at least some points from my video and apply in your practice, and wish you all the best, and thanks for watching. Bye.